Welcome to my world. Another day, another time, another period to acquire knowledge. Knowledge is power, health is wealth. Today's topic shall dwell on abortion, natural causes. There are so many causes of abortion, but what I intend to do today is to look at the laboratory investigations and findings of abortion. Abortion generally is known as something that you willfully, that you decide on your own that you want to do. But there are natural occurrences that it is not subject to your whims and caprices. It's just that there are certain things that are in you that could probably result in aborting that little fetus, that baby in the womb. So let us sit down, listen attentively. But meanwhile, if you like this video, press the like button, subscribe as we go on into the slide section. Let's move. Abortion natural causes. The outline. Objective, introduction, list of pathogen, spontaneous symptoms, laboratory diagnosis, and prevention. The objectives: to create awareness of the cause of spontaneous abortion, also called miscarriage, and propose where inadequate preventive measures to be taken in order to reduce its prevalence. Introduction. Abortion is termination of a pregnancy before birth, resulting in the death of the fetus. This is generally known by almost everybody. Spontaneous abortion, however, also known as miscarriage, is defined as the loss of pregnancy less than 20 weeks gestation. The American College of Obstetricians and Gynecologists estimate it is the most common form of pregnancy loss. It is estimated that as many as 26% of all pregnancies end in miscarriage and up to 10% of clinically recognized pregnancies. Spontaneous abortion occurs naturally because a fetus does not develop normally, or because the mother has an injury or disorder that prevents her from carrying the pregnancy to term. Approximately half of the miscarriages are due to unknown genetic abnormalities, alcohol or drug use, infection, chronic diseases, environmental exposure, and structural uterine abnormalities, and other important risk factors. The lab role is explicit in the emboldened letter. When you talk of infection, the laboratory plays a very great role in finding the causative organisms, and that is where you now even talk of other things like the seroprevalance. Stillbirths happens after 20 weeks of gestation. Preterm is 37 weeks due to uterine contraction. Terms. You have threatening abortion is the presence of vaginal bleeding in early pregnancy, but on pelvic exam, the cervical is closed and the transvaginal ultrasound shows a viable fetus. We have also inevitable abortion, complete abortion, and missed abortion. List of pathogens. These are the causative organisms: Treponema pallidum crucifix, Brucella abortis, Mycoplasma hominis, Uroplasma urine. There is also leptospirosis in pregnancy. Septic abortion is listed because UTI, that is urinary tract infection, could result in septicemia that will virtually cause abortion, the abortion of the fetus. So one should take cognizance that the UTI is a problem. Cytomegalovirus, rubella, congenital rubella syndrome, herpes virus, parvovirus, and toxoplasma gondii. Spontaneous symptoms. When you say spontaneous, it shouldn't be taken for granted that when we describe abortion as spontaneous, then there is no symptom, because symptoms shows visible evidence of something is brewing. However, there are some evidences that could be gotten by laboratory investigation of some parameters during the gestation period of the fetus, especially during the 20 weeks period that are indicative of underlying problems or symptoms. So that is also instructive. Syphilis can seriously complicate pregnancy and result in spontaneous abortion, stillbirth, non-immunoidrop intrauterine growth restriction. This could be prevented with penicillin treatments after performing some serological tests in the laboratory. Developed countries have overcome the complication of syphilis in pregnancy, but many developing countries like Ethiopia, 5% of all pregnancies are lost every year due to syphilis-induced abortion. In Zambia, 24% of all stillbirths. You can imagine what the situation is in other developing countries, all because they are not doing the needful. Leptospirosis in pregnancies, on the other hand, as in the general population, can present with fever and all these other symptoms. Outcome of congenital infection, spontaneous miscarriage, birth weight loss in term and stillbirth, intrauterine fetal deaths, and many other things. The first human abortion due to Brucella infection was reported in 1905 by Thierry in France, followed by Devoir in 1906, who described a case of abortion in pregnant farmers. There are cases of positive culture of Brucella species obtained from human placenta, maternal blood, and urine. Mycoplasma hominis is specifically associated with endometritis and preterm births. Mycoplasma hominis was isolated in 30% of women with intrauterine amniotic infection proved to be associated with PDB. That is in one study. Toxoplasma gondii is one of the major causes of abortion in pregnant women. The three roots are food contaminated with cat feces and water, congenital transmission from mother to fetus. Leptospirosis usually occurs in two phases, which are septicemic phase and also the immune phase, which present with serious jaundice, all called whale syndrome. Rubella viruses, they are teratogenic infection that is causing so many abnormalities in many organs. Infection with rubella virus causes the most severe damage when the mother is infected early in pregnancy, especially in the first trimester. Congenital rubella syndrome is a condition that occurs in developing babies in the womb whose mother is infected. They risk miscarriage and stillbirth and birth defect of deafness, cataracts, heart problems. All these are congenital because they are passed from mother. Cytomegalovirus is the most common infection from pregnant mother to babies during pregnancy. Laboratory diagnosis. You now find that you can take all the blood, the urine, and all these other samples to a culture. Since they are all pathogens, the gold standard for diagnosis remains cultural method, the culture of the blood, urine. Screening tests like VDRL, rapid plasma reaginin, IgG ability assay, FTA, ABS assay, and all the serological tests that have been invented are very important. ELISA is also another test. PCR and Western blot can be used. However, ultrasound is the gold standard for examining the uterine contents and viability. Prevention. Prenatal care is very necessary in order to reduce the prevalence of miscarriage, because during the visit, certain routine serological examinations are done to know if some pathogens are present and the state of health of the mother and the fetus. It's a seroprevalance test. Vaccination against those that have vaccines like rubella MMR, which is unlike cytomegalovirus that is common and no vaccine yet. Treatment with antibiotics, especially where there will be no adverse effect on the fetus, is also recommended. There are so many other things we could do that, like, for example, acquiring this knowledge that is presented here. This will help to mother to know more. And please watch other videos on this channel, so many on health matters.